Okay, welcome to May's Tea Talk. We have a really interesting class today that I'm going to be a complete student of because I know very little about the topic at hand, and we have a great expert who is also a death school alum. Thank you for being with us, Dr. Tatyana. Oh my gosh, I just said your name correctly right before. Kholodkov.
Yes.
Dr. Tatyana Kholodkov, thank you for being here. I'm going to read your intro to just formalize who you are and what we're going to talk about, and then have you launch in and teach us. So, Dr. Tatyana Kholodkov, I've said it 3 times, I got it now, is the owner and founder of Project Yes. She's a first generation immigrant and North Carolina transplant, having resided on both coasts and in the mountains of Wyoming. She merges her training backgrounds in clinical psychology with a near lifetime studying Eastern philosophy, yoga, and meditation. She also studies numerous forms of consciousness expansion practices, shamanism, and bringing the sacred into ordinary life. Dr. Kholodkov specializes in trauma-focused treatment, psychedelic assisted psychotherapy, including ketamine assisted therapy, which we'll talk about today, and end-of-life work. So thank you for being here with us,
My
and
pleasure.
eager to
Yeah.
learn from you.
Thank you so much. So, hi, my name is Tatyana. My pronouns are she, her. I reside in Durham, North Carolina, and I just want to acknowledge that I'm on unceded lands. And just want to take a moment to acknowledge all the factors that had to have come together just right so that we could all be gathered here today, and grateful for the earth that it supports us in our respective places. So today I'm going to talk a little bit about ketamine assisted therapy and how that can support individuals around grief, death, existential distress. I also want to highlight that this is a topic we're going to just briefly introduce. This is something that, in other formats I talk about for many hours, all the way into multiple days. But hopefully, if this is something that you're curious about, you'll at least consider it as a resource. And if you're called to learn further for yourself or clients you serve, that you might look into it more. So first, I'll just tell you a little bit about what is, where all this kind of comes from. And I know there've been other tea talks on use of other medicines before. All of these practices that are used now in psychedelic assisted therapy, this is bringing into the contemporary something that's actually traditional. That in many cultures around the world, there is use of medicines for the purposes of psychospiritual exploration and personal healing as part of pilgrimages and rites of passage, initiation ceremonies for community clarity and wellness. And so, all of the work that's done in the present is, comes from those lineages, and yet is different than that because you're working not only with other molecules, but in other settings, and necessary and yet still opening potentially other realms and subconscious material. So there's lots of different words that are used to describe these molecules and what they do and how they work. The term psychedelic referring to something that's consciousness expanding. And technically, ketamine is not a classic psychedelic. It's not LSD or psilocybin. Yet it's still considered to have psychedelic effects because it still expands our consciousness. And it's also sometimes referred to as a type of empathogen. So MDMA is the most common empathogen. People think about a heart opener, but ketamine can have similar qualities to fostering a sense of connection and empathy, but also deep introspection. A term that's also sometimes used is an entactogen, which is a molecule that might produce more focus and have anxiolytic qualities or introduce a state of suggestibility. The term dissociative applies to ketamine only in the class of medicine that it is. So it's a dissociative anesthetic, but also a piece of the experience can have a dissociative quality, which I'll talk about later, that sense of like detachment and maybe even going out of the body. But all to say, these are all different terms. Some people use them interchangeably. Some people use them, in more strict applications. But for today, we are going to be referring to the psychedelic qualities of of ketamine. And so ketamine is, culturally a molecule we know a lot about. In the 60s, it was already having wide applications. It was originally a buddy drug in the war, and there's significant global use of it, including recreationally, especially in the present. From a more medical perspective, it's considered an essential medicine by the World Health Organization. It's used thousands of times a day, every day for surgeries, including for pediatrics. And it's used for conscious sedation. So, you can even use ketamine lightly and a person isn't totally disconnected all the way to I do not remember the experience, which thank goodness we have that, because we don't necessarily need to remember all of our terrible surgeries and invasive medical procedures. People are also familiar from it from veterinary medicine because it's a type of sedative that doesn't stop the beating of the heart. So if you think about a large animal like a horse or a cow, having to resuscitate that kind of animal would be quite the feat. And instead, you can give it ketamine and its heart will keep beating and you can do whatever treatment that animal might need. Broadly speaking, it's also used for chronic pain management. And there are specialized clinics specifically for the use of ketamine for pain, including for chronic conditions that are like nerve related, but also fibromyalgia, CPRS. That's just important information to tuck away, because even not at end of life, people can be suffering from chronic pain and maybe potential candidates for use of ketamine as a treatment. So I'm not going to totally nerd out with you on all the neurobiology. You can certainly look into that if you're curious. But unlike other antidepressants, ketamine works on a different pathway. It works on the glutamate and the GABA pathway. Why is that interesting? Well, glutamate is associated with anti-inflammation. And so sometimes people get that additional benefit. And the kinds of effects that people experience is, that type of opiate effect, reducing pain. Interesting about that, which can be particularly useful at end of life, is people can often manage their pain more effectively with ketamine and using less opioids. So opioids not only make you kind of out of it, but they cause a lot of constipation and other issues. So if a person can stay more clear and lucid more often as a reduction of those pain medications, that can be helpful. It can certainly calm anxiety and even bring up a little bit of euphoria. When used in this mental health context that we're going to be talking about, some people can have altered perception. Some people have visuals, others do not. There can also be a neuroprotective factor, and there's thought to be a neuroplasticity window where it's really still possible all the way up until our last breath to make some new connections in the brain, and for parts of the brain that don't typically talk to each other to be in communication with each other. And the antidepressant effects from a mental health application. Ketamine treatment has also been around for a number of years, which is still a different model than ketamine assisted therapy. But that's a pharmacological only approach where ketamine is given typically after a person has been unsuccessful at treating their depression with multiple antidepressants, and it can be offered as a support. Restrictions around that, so to speak, have really shifted in recent years. Many people do not require that folks have to have failed 3 antidepressants or still be on an antidepressant to try ketamine. So I just want to dispel the notion that there's that many obstacles in the way. And there's different ways in which ketamine is given. In more of the ketamine treatment model, you're going to often find it's given through infusions. A person is hooked up to an IV, usually in a medical setting. They receive the ketamine for a period of time, a particular infusion, after which they go home. For pain protocols, sometimes people will come for multiple days in a row and get long infusions that are many hours long. And sometimes there are folks using IV for ketamine assisted therapy, but they're also often using sublingual, which is taken through the mouth and absorbed through the mucous membrane. through intramuscular injection that's usually injected into the arm, sometimes through nasal application. People might be familiar with Spravato, which is a particular patented product used for ketamine treatment. But in ketamine assisted therapy, the very different forms of administration are also helpful because depending on a person's frailty, they may be able to tolerate some forms and not others. So, for example, oral is a really gentle kind of experience with a slow entry and slow exit. But for some people, they can't handle sitting for 15 minutes swishing a bitter medicine in their mouth. They'd be a much better candidate for like a lower dose intramuscular injection experience. The downside is a medical provider needs to administer an injection. Some people might not be able to access in-home ketamine services or might not be in a medical state to go into an office to receive an injection. So when bringing this into the context for a client who themselves is medically compromised or at end of life, there's a lot of considerations about can they have this treatment and will it be tolerated, et cetera. But compared to a lot of other things, including other psychedelics, it's less complicated. It's easier to screen into medically speaking. It doesn't affect the heart, can't affect the blood pressure. And really, when you're talking about using ketamine for end of life issues, part of the informed consent process becomes things like, if this does accelerate death, would that be acceptable to you? And is your family on board with that? Or, if there are medical complications as a result of this, are you okay with that? Is the person providing the ketamine treatment okay with that? Not everybody is comfortable with that kind of risk, and other people dearly love and are totally able to embrace that work. So in terms of what consists of ketamine assisted therapy, I'll briefly name that. In all the psychedelic assisted therapy models, there's really three pillars. There's the preparation beforehand, the medicine session, and what's called integration, which is the process that follows afterwards. So in the preparation, there's, a very elaborate informed consent process. There's attention to the setting. There's the process of the person knowing what they're getting into and possibly what are side effects and benefits, understanding how to connect to intentions. There's a relational component because you have to be comfortable with the person who's going to take you into an expanded state. And that whole process in itself, I often think about that medicine work starts from the moment you think about doing medicine work, and it doesn't necessarily mean it's not even about the medicine itself. This recently came up in my community. I referred to somebody to do some underground work, and ultimately this person was considering ketamine. And I think just the relief of knowing that they might have had an option to do it shifted something for the person. They ultimately were not able to access and passed before a session could occur. But we noticed that there was a shift from the time that the conversation happened, and that little bit of hope of like, oh, maybe I could get ready for death. So just wanted to highlight the medicine in the process and not just the medicine itself. The medicine session itself, how long it lasts depends on the route of administration. Oral sessions tend to be longer because you need to wait for the body to absorb the medicine, and you kind of go in gradually, come out gradually. Intramuscular injection sessions, you're feeling the medicine 5 minutes after it's gone into your body. You're at full peak, and you also drop out more drastically. So, at most it's 3 hours, and probably the shortest, it might be something like 90 minutes. And then after the medicine experience itself, there's the process of integration, which is to make meaning or to make whole what it is that came up from the experience. As it relates to end of life work, one of the things that I think is important to talk with people is what if something comes up that's difficult for you or confusing or upsetting, and you might not have a lot of time to digest it just because you're nearing a possible endpoint. What would that be like for you? And for some people, they feel really open to that. And for some people, I think that might be a consideration, especially if they already know, for example, gosh, I have a lot of unprocessed trauma. It just becomes a choice point for that client to make of what would it mean to open myself up. And do I have sufficient support to potentially integrate the material that arises? Um, so in terms of the medicine session, as with other medicines, it's intentionally driven, but you kind of set aside everything you know and sort of hope to receive the medicine and kind of surrender into the experience. But people in the context of end of life work might choose to process like I'm really anxious, or I don't know what's going to happen to me, or I've got this unfinished business, and they might use the medicine to help support that. I like to clue people into that the medicine is, it's not a transaction. It's not like I'm going to ask for this thing and get this thing back. It's more that I have this intention anyway. I know I have some things I'm trying to explore, or get clarity, or get relief from. How could this medicine session catalyze that for me? And then what am I going to do? My own personal responsibility on the other side of it to really take that forward. Um, on ketamine, the way that it can feel, so because it is an anesthetic, even though it's taken at a sub-anesthetic dose, people are generally relatively still. Sometimes they can have movement, but they're not going to be up and about and standing on their feet. In fact, they can be really unbalanced and uncoordinated. And there's not much to see. It's not some other, psychedelics that might make the world very visually interesting. Your vision just kind of gets blurry and out of focus. So it really lends itself well to that inward facing, laying down, eyes closed, eye shades, and going inward and making that choice to go inside. When done in the context of some form of support, as in ketamine assisted therapy, there's also that sense of not having to go there alone and having your safety, attended to, and having whatever arises for you treated with a great deal of respect. In terms of why ketamine, or why, I guess I'll talk a little bit about some of the things that can arise that might warrant a person considering this. First is at any point in life, suicidality. Ketamine is amazing for intervening on suicidal ideation. It's magic. It's really remarkable. And then, even just depression without necessarily suicidal ideation. Sometimes people are really stuck. People might be stuck because there's a disconnect between like the life they're living and some really important meaning or values. I often see underlying trauma that's driving persistent anxiety and depression that needs some attention and help. And when facing end of life in the like empirical research, it's often referred to as this existential distress. That there's a fear of dying, of discomfort, of what's going to happen to the family. And when using kind of other psychedelics that we know a lot more to be researched in that context, we see that people have a reduction in existential depression and anxiety. We see that people often get more clear on the life they do want to live with the time that they have. I had a client who I did ketamine assisted therapy with, and one of the things that she got out of is like just little jolts of energy, and she would use that energy to take care of unfinished business, like take care of some paperwork that had to happen for the family, or try to invite some important conversations with her kids. She was very medically compromised, and she didn't have any like profound, maybe mystical or spiritual experiences, but gosh, those little jolts of energy she got, I think helped her take care of some really important life work nonetheless. The other piece about ketamine as a molecule is that it can take you kind of away from your body, not the same way that like PTSD dissociation feels like I can't feel myself and I've been hijacked, or, I'm suddenly out of the present, but it can take you away from the notion of I you typically walk around with. And when that shifts, sometimes people connect with something that's so much greater than that definition of themselves, a sense of more universal consciousness, or a sense that they are more than their body, which might be frail or sick or in pain. people might, just have a different perspective on even what existence is. And those questions can be really beautiful to have some insight into when you may be at the doorway of death. I want to pause for a moment and just see if there's any questions currently arising before I kind of take it to some other directions.
This is great. I'm learning so much. Sorry, David. I'm counting on you to have questions. So,
Well,
but
it's kind of unusual if we're only three, but I know you're recording it, so I don't want to just hijack the meeting.
Come on in.
come
Yes.
on in.
I don't have any questions. I am an experienced ketamine user, and
Okay, great.
it's new to me to think about using it on the threshold of death. So that's why I'm interested. I was I always say satisfied customer with Erin, my partner,
Mm,
ended her life using our medical aid in dying laws here in
mhm.
Colorado about 4 years ago. And I tried to get her interested. She was very averse to drugs. So I think going forward with other friends as they get closer to that time, if they're interested in drugs, I'm looking or interested in psychedelics and specifically ketamine.
Yeah.
I'm interested in finding out what you're going to say about not so much a protocol, but how it is introduced as a aid to getting over those last barriers. And again, I'm very much interested
Mhm.
in suicide, medical aid, and dying, less
Sure.
hospice, that sort of thing. But so
Mhm.
if there's any focus you can throw on getting people to accept it as a form of not so much therapy, but end of life doulaship is the way I think about it. Because that's my only experience was going through the
Mm.
process with my partner, although I wasn't actually there when she passed. But so
See.
that's my interest. But
Yeah. Well, first, thank you so much for telling me a little bit more about your story and the support you were clearly offering another being in a very personal way. I think understanding some of the indications for ketamine can become part of the conversation of why you might introduce it and how you might introduce it. I think about, with death, there's the person, and then there's like all the other people around them. Ketamine can be incredible for caregiver burnout, just the ability to have a little reset. We know that from some of the research that was done from like frontline healthcare workers during the pandemic, and their ability to like, okay, all right, I can take a breath and I can go back in and do really hard work. So I think the support system can benefit. There's also, I've been mostly speaking to ketamine at the psychedelic dose range. There's another way to work with ketamine that's referred to the psycholytic dose range. And that is a low enough dose of ketamine that a person can still be in conversation.
what
They
kind of dosages are you talking about? I'm used to like 400 to
Doses are so individual specific, so
yeah.
I
Okay.
don't,
Okay.
yeah. Yeah. So, but if we are to make comparison, I would say orally it's 100 or less, which equates to like 25 or less bioavailability. Intramuscular injection, we might be talking about somewhere between the 10 and 25 milligram IM injection really varies, and each person's metabolism different. Other medications on board can blunt it, lots of factors to consider. Working at the psycholytic dose range, particularly with a therapist, allows for a person to actually explore a particular topic, this trauma, this grief, this fear, this decision, and can be really beautiful for relational work. So, like ketamine assisted couples therapy is using that low dose and having you just see people soften to each other. So I think about, the capacity for maybe even if you had somebody who could handle all that, a prescriber, an administrator, and facilitator, but who could even get multiple parties on board to have a conversation that can potentially be have similar effects, but be more tolerable than like a family MDMA session, which is beautiful medicine, but some people can't physically take that medicine on, and that's a really long ride. So there's different applications. I would say when a person is thinking about, well, like, why might I do this at end of life? For some people, it's a preparation for death, a kind of dress rehearsal. right in Colorado, you have an amazing resource because you have Prati, the Psychedelic Research and Training Institute, and they have a specific training that's ketamine for end of life. And if you go, it's incredible. Tell them I sent you their way. They do one cohort a year, and it's just an experiential training where you might just see kind of the other nuances through the what happens in the group. One of the trainings I was able to assist with last summer, we had a person who came in and was really afraid of death, like so afraid of death they used to drive a different route on their way home to like not pass like a cremation facility, and through their own work with ketamine kind of realized, I don't have to be afraid of death. Death is just another transition and another journey, and having that felt sense can give people a kind of comfort and freedom before they're actually walking through that door themselves. And for each person, what conclusions they might arrive at, or what information comes up for them is individual. But I would say if a person is really distressed, anxious about dying, just as curious to do a little psychospiritual exploration or have a conversation with cosmos and their soul, those might all be all great reasons to consider doing this work. Does that help a little bit?
Yes.
Yeah.
I've had those experiences myself as far as letting go of life, letting go of this body. But I've done much more deep diving type stuff with nobody around, and that's a whole different world. So that's why I'm asking about
Yeah.
introducing. And I think I have other people that are very experienced Buddhist practitioners, so they already have a good vision of what's going on in their mind and know how to do
Mhm.
that. And I think that's a lot of good preparation for people too, is having a good relationship with understanding your mind. And
Yeah.
using ketamine has been helpful for me to round that out, to bring your body into, because it is so, the
Yeah,
dissociative
absolutely.
part really highlights where you are in your body, in my experience. And I think that's, if I was really ill with some physical illness, I think that would be an interesting journey to deal with.
Yeah, absolutely. And you bring up also some other things that just kind of jog my mind. You know, many people have a particular stigma against medicines, and depending on where you live, accessing other medicines might not be legal. Some people don't care about that, especially, in critical moments. And for some people, that's really important. Ketamine is legal everywhere in all 50 states. So that's working with a legal molecule. Obviously, it needs to be prescribed. So there's additional barriers that can come up with that in terms of access and cost. But it does have the potential, like many other medicines, for, what are sometimes referred to as like mystical type experiences where people have a departure from their typical sense of self and sense of time and notions of what is real. And sometimes people do have journeys that are very much grounded in their narrative and their story or their lineage. And that's important work too. There's so many domains we can go into with a medicine. But if a person is open, this is such a gentle introduction, even for people who might be curious with working with other medicines down the line.
Well, you've got me very curious now. And the theme that I keep hearing, that runs throughout all of death work is this like dissociation, but in a good way, expansion from the I, being able to have more of a collective or a universal consciousness, being able to step outside of our own limitations and really just like a break from the ego is kind of what it
Mhm.
is. And so we can definitely experience this organically when we're in liminal space, like in death space, in birth space, in meditation, in breath work, in plant medicine and psychedelics, and apparently in ketamine as well. So the question I have for you, which is really just an opinion, it's just an opinion question, but like, as a doctor and someone who's studied this scientifically, do you think that these are all doorways to a spiritual experience, or do you think that it is just our brain?
I mean, my personal relationship is that there are so many different technologies to help us connect with something beyond ourselves. The word I like to use is the divine because that's the word that speaks to me. But for, for someone else, that might be nature or, the universe, or for some people, they do relate to it as just their own deep inner intelligence. But yes, and beyond those beautiful things you already just described, like breath work, there's also like mantra and meditation and singing and dance and fasting. And so every culture has ways they've accessed these doors. And so, the way that I relate to it is, yeah, like I often use this metaphor of like when we take a medicine, it's like we're given a set of these like custodian keys. We just have no idea what doors they're going to open that day. And it's kind of our job to then reflect on the doorways we went into and to make meaning of them, rather than it just be like, oh, I saw some doors, and I kind of let it go. A friend of mine refers to those as like hot tub experiences, and I am not anti recreational use of anything as if it's safe, but I do think that there's a way in which it can be definitely a spiritual practice.
Yeah,
One
hot tub
caveat to that.
experience is a good designation. Like,
Yeah.
and that would just
Yeah.
really be the lack of integration would kind of be the difference, would you say?
I think there, I mean, there could be a number of things. Certainly, people have not so great things happen without sufficient preparation, or not in good context, or not good support, or doing it alone, adverse effects. There's a thousand things that could happen. But, one thing that I will put out there is, and it's explicitly in my like ketamine informed consent, which is beginner's mind and moderate expectations. Sometimes people say like, I really want to have this experience where I connect with the divine. And that's not at all what the medicine gives them. Medicine is like, what's up with these bills you keep avoiding paying, or like, yeah, that thing with your sister that you thought you're over it, you're so not over it. And then they're like having a difficult thing that now comes up and needs their attention, and they thought I thought I was going to disconnect from myself and be with God. So I like to, whoever I'm presenting the idea of psychedelic work to, including ketamine, I like to not impose too many ideas, and I also invite them to, like, it's okay to have intentions, but also to hold them in your palm of your hand gently without squeezing around them.
So would you say it compares in that way to psilocybin? Like it's great to have intentions, but you can't really drive the whatever's in there is in there. We're
Yes.
just saying yes to opening the box and seeing what it is, kind of.
Yes, yeah, and again, people may have really beautiful intentions, and it's still their work to connect with them. If they want to like forgive something or process something, they might be working on that beforehand. They might be taking advantage of the neuroplasticity window that comes after the experience, which is about 3 days for ketamine. So that's like really the time to act on your intentions, whether the medicine sessions seem to have answered them or not.
Very cool.
Yeah.
Well,
Um,
I'm
I think
sold.
the notion of the thing that was most impressive to me was the notion of another world that we don't normally perceive, that is welcoming, and it's like going home. And so for me, it would be a good way to overcome fear if other people had that same kind of experience, if you're afraid of death, because it's very much like, oh, we've been waiting for you. Welcome back. Where have you been? That sort of thing.
That's what I think death is like. Are you saying, David, that that's your experience of ketamine as well? Is that
I'm
that?
saying that's what my experience of ketamine was. Yeah, I haven't had any like near death, or I'm not a death worker like you, so I'm not around people that have. But that's to me, again, the idea of using ketamine to death is new, and I'm here in this
mm,
section because of that. But that would be to me something, if you're really afraid of dying, would be a great relief to feel like you're going back to where you came from,
yeah.
basically. You're going
Yeah, and the
home.
way I might frame it to someone is, you are afraid, and right now your mind just keeps looping how afraid you are. I wonder what it would be like for you to have a little pause from that loop, and maybe you would understand a little bit more of what's underneath just those worries, or maybe you'd find a different perspective to relate to the problem that you're carrying right now. So I might talk to a person about it in that very open-ended way of, is the currently you seem to be suffering. At the very least, this might put a pause on it, or yeah, or help you examine things from a different point of view. And just yesterday, I had multiple ketamine sessions, not specific to end of life, but I had one person who thought they're going to be processing this like really sorrowful thing, and instead they connected with tremendous joy. And they also had something else come in that they had not really given much thought to ever in their life in that particular way, found intense compassion for a person that's in their family that they generally feel very angry towards. And I even think about that, like how beautiful that you might take care of some things that your soul longs for. We all have stuff. And this helps us maybe carry a little less baggage the next time around.
I am definitely sold on the benefits and wish you were here in Colorado so I could just come and have a session with you.
Oh, but I can refer you to great people if you need it. So
Okay, great, great.
Me too. Me
Um,
too.
yeah, you too. Oh, does it help with ADHD? Because I was getting ready to ask you another question, and then we said something else, then I lost
I
it.
do not think it helps with ADHD. There's no evidence to indicate it helps with ADHD. However, it can help with the anxiety and or depression that sometimes can make ADHD worse. And so that's all I would say about that. The day of a ketamine session, a person needs to also not take their stimulant, which some people that's okay to do, and for some people it can feel really tough to take a day off. But relatedly, I did want to take just for a moment to share with like whoever might listen to this later some of the contraindications, which again, all of those can go out the window when you're working with someone at end of life because they may not be as concerned about this.
Great.
Or they might be saying like, fine, I don't risks and all. So some of the medical contraindications are blood pressure that's not well managed. Ketamine does increase blood pressure. Um, and so for some people that they've also had past cardiac episodes and things like that, medical providers won't give them ketamine unless it's in a setting where it is IV, meaning they can turn off the medicine. And there's continuous monitoring of vitals, which you wouldn't have in many other like ketamine assisted therapy or in-home type settings. If a person is trying to conceive or become pregnant, that's a contraindication. However, it can be given just after giving birth, even to breastfeeding parents. You can pump and dump, and after a few days, the ketamine is totally out of the body, and preliminary research suggests that it's safe. Sometimes people have some other things going on, like obstruction of their breathing. People with sleep apnea might need to have their apnea machine on and also be supported to assist with respiration. And then, then other things are just more nuanced. So like one of the individuals that I worked with, this was a person who had a very complicated presentation of Parkinson's that was atypical. It was rather than the musculoskeletal, it was like central nervous system related. So this person would have these episodes that would be like a blend of fibromyalgia and panic attacks, intense pain throughout their whole body, coupled with intense anxiety. And they weren't even leaving their home. So I was very fortunate. I got to work with a palliative care doctor who was very ketamine savvy for pain and way comfortable prescribing it at much higher doses than I would ever need, and was totally fine prescribing for in-home use for this client. And so I want to highlight that sometimes palliative care doctors can be great to partner with because they already know this molecule well. In other cases, it's important to co-consult with people's team, whether that's their cardiologist. The other client I referenced earlier had stage 4 cancer. And so we were timing when this person was getting blood transfusions with when the ketamine could happen. And then at some point, this person wasn't continent and, had just other things that were going on that made it really difficult to come in and out of the office. So depending on the kind of ketamine administration a person needs might make it more or less accessible to them. Psychiatric contraindications: active psychosis, active mania, past history of psychosis. There's certain significant substance abuse issues that might also get in the way, not just because they'll be problematic, but also because the ketamine might not be as effective. And certainly inability to consent. So consent, especially at end of life work, is an ongoing process. And there might be one session or one day that the person is totally able to consent, and then the next day their functioning has changed and they're no longer able to consent to the experience. One of the people I worked with, I found that it did not at all help with that was the Parkinson's client. This person also had some other issues going on. One of the things that it highlighted was actually that this person was starting to have a process of dementia. Once we got the mood symptoms a little bit lifted, the dementia became way more apparent because it was impossible for the person to kind of like mask it just under depression symptoms. So, and other last contraindications is just insufficient support. Or sometimes people have really strong somatic concerns, like if a person is terrified of nausea and vomiting, that's a side effect of ketamine. So that might be an additional potential kind of contraindication. Yeah, I'm wondering what else might be helpful for us to, we can go more of the mystical route, or if there's other questions going.
I'm interested in both the mystical and the practical routes. I have questions kind of on both sides. Like when you mentioned that it's magic for suicidality, it made me wonder, like, A, are people unconsciously, kind of self-treating it, for their own depression? And we talked a little bit, certainly not advocating for recreational use or for doing it in an unsafe way, but like, how many sessions do people need? What turns it from something that could be, reckless to something that could be really constructive if you're dealing with depression? And then I guess kind of on that same kind of note, like we talked a lot about it supporting anticipatory grief, but what about like after death,
Yeah, I think those are all great questions. So let me see if I can jog up again. Remind me of the first one.
Suicidality.
Suicidality. Okay.
Yeah.
So if I'm seeing a person for like acute suicidality, I'd like to see them probably maybe even multiple times a week for a couple of weeks, for 2 weeks, to really layer the medicine pharmacologically and see if we can just get them out of that rut. And a lot of infusion clinics function off of this, like they prescribe you a particular regimen of treatment. Usually it's 3 times a week for 2 weeks, and then they'll start lowering the dose. That protocol, though, on its own doesn't have as much evidence base. That comes from the ECT world. ECT was given on that kind of regimen, and then ketamine kind of adopted it. But what we actually see for suicidality is that, yes, multiple administrations close together in time can really help provide a person relief when it's more acute. I also see that, though, when a person is really stuck in persistent hypervigilance with PTSD or really severe burnout, that having a couple of sessions close together in time can make a lot of sense.
Gets
Can
you out
really
of like
make
a
that jolt.
spin cycle, no matter what the spin cycle is. Right. Like
Yeah, yeah.
it's numb, it's subduing the pain and it's opening up your consciousness to find new sources, new pathways and new ideas and break the pattern.
Yeah. And even giving a little bit of relief, because for a lot of people, they will experience relatively immediate relief, even like anti-anxiety effects. For some people, it can bring up more uncomfortable emotions first, and then down the line, depending on integration or even just the passage of time, they can feel better. But usually, I'll know whether a ketamine session has been effective for someone within a week.
Okay, wow. Okay.
So
Really
that's,
measurable.
that's pretty powerful. Yeah.
It's really measurable.
Um, your other question, I sometimes bring in these, like, they're called the 4 universal concerns, which are just like existential things we grapple with, like death, just knowing that we're mortal, and at the same time having like all these instincts to preserve our life. Loneliness, that knowing that we ultimately come into this world alone and ultimately die alone. Freedom, a sense of like, what is freedom? What does it mean to be free? And then the question of meaning and meaninglessness. So all 4 of those universal concerns can come up for the person themselves at any point in life. We each might grapple with those questions, especially at the brink of death, and might also be questions that are left behind for the people that remain. When someone has passed, like, what does my life mean? I love using ketamine for grief work. It can often allow people to actually metabolize their grief. And in particular, sometimes death happens in such a way, and there's so much to do and so much to take care of, or a lot of other life happening, and there isn't an ability to digest it. And so it's just frozen somewhere in there. And then it can manifest as like persistent depression and any other number of things. But I think grief work can be really powerful, even ambiguous grief, the kind of grief that comes from other endings, things in life not working out the way that you had hoped, unexpected illness that causes like frailty or the body to be unreliable. So many different possibilities there.
Yeah, good. Okay, last question I can think of right now, and this is kind of jogging back to more esoteric topic we were on a few minutes ago. But, you know, regardless of the intentions you go in with, you might, as you said, have this amazing experience where you're dancing with rainbows and having happy feelings, you know, whatever. You might
Yes.
have an unexpectedly delightful, enlightening experience, or you might be really uncovering all of the stones and, you know, having a challenging experience. And that can kind of go in either direction, regardless of which intention you have. So, what do you think determines that for someone?
I don't think there is such a thing that like, what is it that determines? One thing that can be important at before any kind of consciousness expanding activity is to be really mindful of what you're around, what you're taking in. I encourage people to have a social media and news fast, just as much as they might also have a fast from food, because whatever sort of in our sphere can affect us. And yet at the same time, like, yeah, it's going to affect us. And so we might feel pain because there's pain in the world, right? We're not necessarily trying to remove ourselves from that. But otherwise, yeah, I think there is that way in which the medicine goes where the medicine goes. And it can't necessarily be predicted.
Do you think the medicine has a consciousness?
I think the medicine is a technology, and the consciousness is like almost higher than that, like in the order of things. When it comes to, yeah, I think that it. I do see a distinct signature of ketamine that's completely different than psilocybin, for example. I really relate to psilocybin as a master plant teacher with very much its own spirit. So to me, I don't feel necessarily a sense to the spirit of ketamine, but I do see it as a very distinct doorway. And I'm grateful to all the intelligence that allows it to be. Um, you know, quick, very small nerdy fact, but ketamine is actually found in nature. That's not where most of it comes from when we're taking it. It's a synthesized molecule. But on the flip side, people are, really passionate about all the studies being done with psilocybin. They are all using synthetic psilocybin. They're not using mushrooms, and people forget that. So it's more about, I think it's less about is it natural or not, and more about like, let's look at the capacity that it has and what it can open.
Yeah, I didn't know that
Yeah.
people were consuming synthetic psilocybin as equally.
All the Hopkins studies, really everything that you're reading is using synthetic because it allows it to be standardized. It's one molecule, it's exactly the same everywhere.
Got it.
Very
Otherwise,
precise
there's so
dosing.
much variation in the plant.
Totally, totally. Yeah, yeah,
Sense.
yeah.
Well, this is really fascinating. I admire your career and your work and your study and what you're doing. How does it feel to do this work? Do you like it?
I really love it. I think that sometimes it can be a lot. And also, like, I come from a background of working in a very integrative way. I used to work at Duke Integrative Medicine and then was part of an integrative health center after that. And I think doing psychedelic work, sometimes people are seeing me just for that work. I'm not their primary therapist, but I might be in communication with who is referring them to me, whether that is their acupuncturist or their doctor or someone else. And the reverse is also true. I'm often sending folks to tend to other aspects of themselves with other members of the healing community, and letting the thing about this kind of work is I think it gives a lot of agency and power back to the client. It's not hierarchical. I really defer to the client and the wisdom that comes up for them. And that in itself is really powerful. We're often told so much of like, this is what's happening and this is what you're supposed to do. And everybody has an opinion. But when you step into, that altered state, that's not coming from anybody else, or it doesn't feel like there's someone else giving you their opinion. It's coming from beyond.
The
That in
noise
itself
kind of
is,
goes away.
yeah, and that itself is really powerful. So I love the work, and there's a lot of need.
There's a lot of need.
Yeah,
All right. Well, thank you so much for educating us today. I'm going to
sure.
follow up with you for sure. Yeah, I just
I wanted to
admire
throw just a few other quick things out there just for people to consider. And I think y'all talk about this as part of your work with your program, but There's lots of ways we can access altered states. And, you could consider the use of sound and the use of aroma, the use of touch. In fact, I'm going to go help somebody who, Kathy Edwards Brooksy is a death doula who runs Heart to Heart NC, and she trains people on on ritual work and touch at end of life. And all of those things can produce an altered state, because the closer we are, we're already in a so-called altered state. And so you might not need medicine to further expand. So I just hope that people explore other tools, including the intelligence of plants that we smell through aroma. That's a really beautiful way to work.
I think that is so wise. And, we're talking on one end about technology and what we can do, but really, I think that liminal space that we have access to and that wider consciousness that we have access to would be more available through our everyday path of just journeying through life if we didn't have so many distractions and if we weren't so busy. And, we have a lot more intuition and sense about it than we know. And so a lot of these avenues that we're taking just peel away the distractions and put you back in touch with the source, but the source was always there.
Absolutely. Yeah, beautifully phrased. Yeah.
Well, thank you so much. We appreciate
Yeah,
it.
my pleasure.
I look forward to talking to you again next time. How can people get a hold of you if they want to work with you?
But the best way to reach out to me is through my website, which is theprojectyes.com/contact. I'm on Instagram at Therapy Mindfully. If they're curious about what I mentioned earlier with that touch related workshop, my name is not on the website, but I will be actually helping people journey with aroma and things like that. That's Heart to Heart NC. Yeah, I'm happy to be a resource. And also there's really beautiful wide networks. Prati is the organization I mentioned earlier.
2 pages of notes.
Yeah, and Prati does allow death doulas to come into their trainings. You do not have to be a licensed mental health or health provider. And folks who are spiritual leaders like chaplains and are also welcome to come as well. But yeah, there's definitely other resources if folks, or if you get inquiries, feel free to just reach out to me and I'd be happy to ping additional resources to the community.
Thank you for sharing your time and your wisdom with us.
Of course. Thank you so much for having me.
Thank you very much.
All right. Have a great afternoon, everyone.
Thank you. Bye-bye.